Welcome to Teaching Tips Tuesday. My name is Jared Kittleson. I am Chief Operating Officer here at Foundation for Blind Children. And today I have the distinct privilege of welcoming Jonathan Graves to Teaching Tips Tuesday. Jonathan, welcome.
Hey, Jared. Thank you so much. Thanks for having me.
Jonathan, tell us what you've been up to. Where are you? What's your role? All the exciting things you've been up to.
Sure. So I'm a teacher of the visually impaired, and I recently started a new role at the pediatric view practice at the Children's Home of Pittsburgh and Lemieux Family Center. I work on supporting children and families with cortical visual impairment, and I help provide school supports to schools who need some bolstering in the area of how to structure CVI accommodations. It's the new home of Dr. Christine Roman Lancy, who has worked to develop the CVI range. So it's an honor to kind of join her and work alongside her.
You've had an exciting career. It's been a joy to kind of watch you evolve over these last 5 years. That's for sure. So,
Thank you.
Jonathan, I understand we're going to talk about the importance of CVI assessments. Why are assessments so critical for students with cortical visual impairment?
Great, yeah. So cortical visual impairment is a condition in which a child's eyes are taking in visual information, but their brain can't process what they see. And unlike ocular impairments, which tend to be kind of static in terms of their impact, cortical visual impairment can improve with the right supports when we provide opportunities for children to visually access kind of the world around them. And that those accommodations differ depending on the impact of CVI. So we use the CVI range assessment, which is a way of measuring the impact of what we call the 10 characteristics of CVI on a child's visual function. And by doing that assessment, we can kind of sort children into 3 phases, which helps us to determine what they need at school and at home to better see the world around them, and then hopefully to help them improve their functional vision over time.
So, Jonathan, you mentioned those 3 phases. Can you talk a little bit more about those 3 phases and why those are important?
Sure, yeah. So children who have, children with the most impacted form of vision would be kids who score between a 0 and a 3 on the CVI range. Those children are in phase 1. And in phase 1, kids in phase 1 tend to not appear to show much visual attention to objects in typical environments. In order to support them, we're doing things like lowering the lights in the room, adding a ton of light to the objects we want them to view, using really bright color and specific color based on their color preferences, adding movement. And our goal is only to help them notice that an object is there and they can attend to it. So they may not know what the object is necessarily at this point. They might not have, their interaction might be fairly slight, but we're just encouraging the development of their visual system.
Right.
In phase 2, kids are going to score between a 3 and a 7 on the range. And phase 2 is all about, kids in phase 2 might have more stable vision in more environments, and they might show some recognition of really familiar objects. But we want to help them understand how they can functionally be engaged with things by reaching for objects, by using their bodies to activate things around them based on what they see. And so we also start to see that kids go, their sort of Google search engine of things they know grows a great deal. And they go from knowing only a couple of things to having a lot of objects and people around them that are part of their environment that they recognize. They also can start to go from only using real objects that are 3-dimensional to being able to interpret photographs of objects, or even more complicated images like a color illustration, or even a more abstract kind of drawing. So that process really takes time, and it takes some really specific work by targeting the salient visual features, we call them, of every object. So, we might start with a stuffed elephant and say this elephant has a trunk and it has round ears, and we can see those. And then we take the child to a photograph of an elephant and point out those same things.
Okay.
That's kind of how that operates. So as kids move up the range and they get into phase 3, we start to see that maybe some characteristics are less important than they used to be. So maybe a child in phase 3 doesn't really have a color preference anymore. They can see lots of different colors equally well, and they start to be able to have enough discrimination visually and recognition to be able to get into literacy activities. So we start to work with text with these kids, and we can use some different strategies to help them develop understanding of literacy, continue to refine how they process images, and broaden the number of experiences that they can participate in. We still have to provide lots of support, but that happens in, they're using their vision almost all throughout the day. And so there's lots of chances for learning opportunities with vision.
Excellent. Jonathan, you know as well as I do, CVI becoming the prominent visual impairment in our younger population. What tips do you have? Could be a parent, could be a fellow vision professional, community member. What are some tips for someone who might suspect CVI but don't have that diagnosis?
Yeah, that's a great question. So a CVI is officially diagnosed by an ophthalmologist or a neuro-ophthalmologist, or a neurologist. And that diagnosis is made because the child has a history of neurological impairment, could be from many, many causes, but common ones include, a seizure activity, a genetic disorder, a traumatic brain injury, could be issues that, things that happened during childbirth that caused some developmental injury. And, so that's one important characteristic. Another diagnostic criteria is that, a lot of kids with CVI will also have some ocular impairment, but that ocular impairment doesn't satisfactorily explain their level of visual function. So there's not enough impairment for the degree of lack of visual attention that they might have. And then the third criteria is that presence of those 10 characteristics. Now, the diagnosis of CVI in some cases is really straightforward and easy for parents and caregivers to get. In other cases, it can be harder, it can be more of a search. And so, what we look for with kids where we suspect they have CVI is we might still say, let's do the CVI range and see how that comes out. Because the information that we gather there about how they're using their vision in these accommodated activities can really support taking that to a medical professional and saying, this is something that I'm concerned about, let's look at it more. And so we see a lot of times where a TBI might do a range assessment, and then that helps inform the final diagnosis. Gotcha. So what we're looking for, if you are working with a child, we're looking for things like strong attention to light, only preferring really specific, very familiar objects that the child uses over and over again. Difficulty with visual processing in really noisy, busy environments or very crowded environments. Difficulty with visual motor tasks like reaching accurately for things that are there. So there's characteristics like this that can really help raise the flags that maybe an assessment is warranted, and further conversations with those doctors are warranted as well.
Excellent stuff, Jonathan. Thank you for sharing today. Jonathan, thank you for the time. We certainly appreciate. Hopefully, this is the first of many Teaching Tips Tuesday you join us on.
I would love it. Thank you so much for having me, and it's great to see you again.
Thank you, everyone, for joining us. If you guys have a Teaching Tips Tuesday you'd like to share, please let us know. Share with your friends, and we'll see you next time.